So healthcare is obviously unusual, and when we're talking about digital healthcare, it's unusual in the fact that it's easy or easier to see how you can commercialize digitized banking, right?
Mm-hmm.
Because you don't have to essentially, when healthcare, you don't really have to essentially undress, right, and tell your story. So
Right.
so you're at a disadvantage when you go into healthcare because there you are in one of these floppy gowns, right? And you're telling your story, and you're really, it's not your natural environment, right?
Vulnerable.
Yeah, you're vulnerable. So I think the key right here is really to take out that vulnerability, if you will, right? Is to make it as personal as you can, or personalized as you can, right? So that you
Mm-hmm.
can address that healthcare problem, right? And get rid of that vulnerability so that you're really on equal footing with the people. So that, as we find out, actually interesting, and I'll get to the commercialization, is that people are willing to tell you a lot more about themselves, just like on social media, when you level the playing field.
Mm-hmm.
So given that, that's one aspect. The second aspect is, and I'll go back to the clinical problem in terms of commercialization. Again, there's lots of technology out there, Roxy. There's just lots of technology out there.
Sure.
But if you don't really have a problem that's of sufficient magnitude, and passion, essentially, then it's just going to sort of sit there as a technology, and it might be acquired, but it doesn't really do anybody good. So the commercialization always comes with a good product and a good clinical solution. So
Mm-hmm. Mm-hmm.
so that's foremost, in my opinion.